Michael Sevilla is here with me today, Dr. Michael Sevilla, to be specific, from Salem Community Hospital. We're talking about colon cancer because March is Colon Cancer Awareness Month, and it's something that affects a lot of people. How many people exactly are affected by this disease?
Well, I was doing my research about this. I mean, it is millions of people, and we are diagnosing it earlier. And what we kind of talk about with patients is some of the risk factors that people have to look for, and one of them is age. Above age 50, whether you're male or female, we talk to patients about getting screening. If you're a smoker, if you have a sedentary lifestyle, you don't do much, or
if you have a family history,
that is something that's very key these days when it comes to colon cancer screening.
Now that's for specific people, but who could forget when Katie Couric went on air and got her colonoscopy live on television after what happened with her husband? How much have things changed since that time in terms of the treatment and even the diagnosis?
Well, the diagnosis, I have a lot of patients coming to me talking about screening, talking about getting treatment. We're catching it earlier. Treatment is, a lot of it is surgery, but some of it is also chemotherapy. So we're really making some advancements in it, but I think the big thing is to get screened so we can catch it earlier and treat it appropriately.
Prevention, of course, is always the cheapest way to get around it. What should people be looking at in terms of what to avoid? You mentioned that some people are more at risk, tobacco users for one.
Absolutely, yeah. And people who have symptoms sometimes have abdominal pain or some abnormalities with their bowel movements and things. Sometimes those are symptoms. We also ask about, a family history too. That could be a key risk factor for people to get screened for colon cancer.
You might need to change your diet and things like that too.
Absolutely.
Doctor, thanks so much for coming in. If you have questions about colonoscopies, colon cancer, you can call this number at Salem Community Hospital. We'll be right back.